So, hello everybody. My name is Alpana Mair. I'm Head of Prescribing and Therapeutics at Scottish Government, and I'm delighted to introduce you to this session looking at how we can address medication safety and medication without harm at each step in our care of the individual patient. Why is this area important? We know that many people are living longer, which is a good thing. And as they are living longer, they are presenting with more long-term illnesses which occur together. And as a consequence, they tend to take many medications at the same time. And these medications can be taken maybe 2 or 3 times a day. And so it's important for us to think about the consequences of these medicines. We know that medicine provide a benefit, but they can also cause harm. And it's estimated in different countries, but if we look at the UK, that up to 11% of all admissions to hospital are caused by medication-related harm. Now, if we just translated that across Europe, that would be 8.6 million admissions every year due to medication-related harm. And half of these are preventable and on people that are only taking 4 or more medicines. So it's really important for us to encourage our patients and our healthcare practitioners to really ask about medicines that people are taking, to encourage people to ask the questions why, and to use the tools that are there to enable them to do so. And you can just see taking opportunities while people are waiting for consultation would be an ideal opportunity for them to do that. And we can do this by undertaking patient-centered medication reviews, where we encourage to ask the patient what matters to them, ensuring that they're on the right medicine and that we review the medicines and make sure that they're being effective. And importantly, having a plan that the patient is able to manage and work with. And the WHO has 3 key areas of focus that we might want to look at, thinking about polypharmacy, where people take multiple medicines, high-risk situations, and transitions of care. So I'm delighted to introduce you to the first speaker, who is Ayun, who's going to who's a consultant at the local office in Mongolia, who's going to talk to us about medication safety and 5 moments of medication safety. So over to you, Owen.
Hello, good morning, good afternoon, and good evening. And my name is Soyun, and I work as a national consultant for the WHO office in Mongolia. And now I'm presenting Mongolian experience, our experience in medication safety, medication without harm. So I will start my presentation with the policy environment of how we address. Next slide, please. So I'll begin with the policy environment on medication safety, like, how Mongolia addresses on medication safety. So first of all, we have law on medicine and medical device, which was approved in 2010. And in this law, the safe use of medicine was defined. So the safer use of medicine was defined. It's like a correct use of medicine, correct use of drugs and medications according to instructions and recommendation of physician and pharmacist if it's needed. So national drug policy is an integral part of Mongolia's national security policy. So in the article number 17 was discusses about the safe use of medicine, especially in article number 17.2 in the law on medicine and medical device. It says physician is responsible for prescriptions according to standards, and the physician also is responsible to explain and advise to patients and clients on methods of use and duration of use and side effects of the drugs. Besides, we have law on medicine and medical device. Also, we have a standard MNS 5376 2016. This standard discuss or address the prescription forms and enforcement of prescription entry standards and provision of prescription forms. And this standard is available online on such a link. And then this standard also implemented in all levels of healthcare institutions and also pharmacies. And this standard is also used to monitor prescriptions. So, so beside these couple of policy papers, we also have a national action plan on patient safety, which was approved just recently in 2022. Also, in addition to that, we have a national database for incidence reporting and learning systems, which was, this software was developed in 2021. So now it's effective to be used. So this is like a policy environment on medication safety in Mongolia. Next slide, please. So as we have a policy, a number of policy documents which address on medication safety, we have also improved technical competency of healthcare providers on medication safety. For example, we have a national patient safety network which was established and which address stakeholder engagement, knowledge sharing, and capacity building. So this national patient safety network on a regular basis conduct a number of training or technical sessions on variety of a wide range of patient safety issues, including medication safety. Also, we have developed postgraduate training syllabus or curriculum, which also include the patient safety issues, including medication safety. Next slide, please. So here I would like to mention about what initiatives we have developed and we have conducted for celebrating of World Patient Safety Day in 2022. So, for example, during the World Patient Safety Day 2022, we have been conducting a range of advocacy and awareness raising activities and events and initiatives, especially address the safe use of medicine. So in this regards, we have translated number of technical documents developed by WHO. For example, we translated the Medication Without Harm, WHO Global Patient Safety Challenge. We have translated 5 moments of medication safety. We have translated the World Patient Safety Day 2022 theme, slogan, posters, highlights, key messages, and animated short videos and events. Huge number of events were organized, not only to celebrate the World Patient Safety Day, but also this has been lasted for weekly basis, monthly basis, and we address and we mentioned that it shouldn't be only one day, 17th of September. So it should be every day. Should be Patient Safety Day. So next slide, please. So as you can see from this slide, how many technical documents and resource materials we have been translated and distributed, disseminated using the mass media channels and using social media channels, etc. So as you can see, the wide range of documents on this slide. Next slide, please. So not only during the 17th of September 2022, we've been organizing numerous extensively the medication safety webinars for healthcare providers on promotion of prescribing, correct prescribing, dispensing, transcribing, and administration and monitoring practice for safe medication use at all levels of care. Next slide, please. So as you can see from this slide, also we engaged multi-stakeholders involvement. For example, university students, college students, lecturers, professors of School of Nursing and School of Pharmacy of Mongolian National University of Medical Sciences were very actively engaged in Patient Safety Day 2022 campaign. And also there was a student contest for writing essays among students and followed by pledging signing up activities to unite on Patient Safety Day. Next slide, please. So at the evening of the 17th of September 2022, so we organized a national public event at Sukupate Square. Sukupate Square is the heart of the city. So we distributed a range of materials, a range of messages to raise public awareness and public education. And there was hundreds of leaflets and brochures on 5 moments of medication safety. And those materials were posted on Ministry of Health and the Center for Health Development and other key stakeholders' web pages. Next slide, please. So as you can see from the slides, how actively were engaged college and university students, by explaining on 5 moments of medication safety and safer use of medicines, etc. So the 17th of September was full of events and full of initiatives and full of activities. Next slide, please. On this day, also TV interviews were taken concerning medication safety, and that TV interviews was broadcasted at the National Mongolian Broadcasting Channel. Next slide, please. So in the evening of September 17th of September 2022, the government buildings and landmarks, monuments around the Sukupate Square have been lit up in orange color for celebration of World Patient Safety Day. So here you can see the many photos and the pictures how we were celebrating the World Patient Safety Day this year. So this is my end of presentation. Thank you.
Thank you very much, Ayun. It gives me great pleasure now to introduce Professor Priya Galathapalli to you. Priya is from University of Colombo and who's going to talk to us about implementing a national plan for Sri Lanka. Over to you, Priya.
Thank you very much, Alpana, for the kind words of introduction. So during this short 5-minute presentation, I will try to highlight how Sri Lanka tried to implement the National Action Plan on Medication Safety, going along the WHO initiative on Medication Without Harm Global Challenge. Next slide, please. So in response to the data which shows that worldwide there is a great global burden due to medication errors, in 2017 the World Health Organization launched the third Global Patient Safety Challenge on medication safety with the theme Medication Without Harm, with the objective of preventing serious patient harm due to medication errors over a period of 5 years. Next slide, please. So in order to consolidate and accelerate the activities throughout the world, in 2022, the World Patient Safety Day was dedicated to the theme Medication Safety with the same slogan, Medication Without Harm. Next slide, please. So WHO proposed a strategic framework where 4 key domains were identified with 16 subdomains and 3 action areas, which they requested each country to identify the problems in each of these areas and to identify strategies for implementation of medication safety action plans. Next slide, please. So in Sri Lanka, we set about developing a national action plan for medication safety to prevent serious patient harm due to medication errors in the country. And we looked at the data on the 4 main domains and identified the problem areas and then developed a national action plan to address those key areas identified based on evidence. And we involved all the key stakeholders for the implementation of the development and implementation of the National Action Plan. Next slide, please. So in the National Action Plan, we identified 3 main sectors for which the National Action Plan should be developed. Obviously, the private sector hospitals through the Directorate of Healthcare Quality and Safety and actions through the Regulatory Authority. And then for public sector hospitals through the Private Sector Regulatory Authority. And then for the private sector pharmacies, because the problems of medication safety that happens or that is relevant to each of these sectors can be different, and we involve all stakeholders, the professional associations, colleges, as well as patient groups in developing the National Action Plan. Next slide, please. So the National Action Plan was developed over several consultative meetings and workshops held, and then we were able to launch it on the World Patient Safety Day in 2021. And this is the cover page of the document. Next slide, please. So in the National Action Plan, we identified for each of the 4 domains the activities proposed, and then there were sub-activities. We identified key performance indicators, the stakeholders, and those who are responsible for implementation. So on the systems and practices, one of the key activities that we proposed was developing, introducing a national medication incident reporting and learning system, because that was not available in Sri Lanka, and we developed a separate incident reporting form, and we identified the key performance indicators relevant to this activity as the percentage of hospitals having a functional system and number of events reported, and this has been now implemented. Next slide, please. On the domain of medicines, we identified developing a list of high-risk medicines as important, because that was not there. So the preparation of a high-risk medicines list and identifying standard operating procedures to identify them and to implement those in hospitals is a key activity that was proposed. So one of the KPIs would be availability of a list in the hospitals and addressing them during the medication use process. Next slide, please. Another important activity was identifying a list of look-alike, sound-alike medicines, because such a list was also not available. So we have now developed a list of look-alike, sound-alike medicines from the studies that are conducted, and we have recommended implementing tall man lettering and then segregating storage. So those will be looked at in the hospitals, whether those are being implemented as KPIs. Next slide, please. Coming to healthcare professionals, one of the most important activities proposed was is implementing the WHO Patient Safety Curriculum Guide, where there is a section on medication safety, and we actually did that for the medical undergraduate curricula, where we held a workshop for all medical schools, and now medical schools are implementing the activities in the curriculum guide. We are planning to implement the same for the nursing and pharmacy curricula as well as conduct, and we have started conducting CPD, continuing professional development activities, for all categories of healthcare professionals through the Directorate of the Healthcare Quality and Safety, where online activities are conducted on medication safety. Next slide, please. Finally, for patients, improving medication literacy of patients is a key activity, and we have proposed a variety of activities to improve the medication literacy among patients. Next slide, please. So in a study that we did, we found that the baseline knowledge on medicines was rather poor, because only 17% scored good knowledge. And we found that if we give written information in the patient's native language, which are Sinhalese and Tamil for most of the patients, that knowledge improves up to 74% when the information is written in their own language, compared to verbal information, which also improves, but the written information improves significantly. Next slide, please. So empowering patients by improving their medication literacy is one of the key activities. And in fact, this can be done, we thought, in Sri Lanka, because we record a very high overall literacy rate of 92%, highest in Southeast Asia. And so providing medication plan in, as I mentioned, in their own language, and providing patient information booklets and newspaper articles, TV programs, which are used widely in Sri Lanka, are proposed to improve the patients' literacy on medicines that they are using. Next slide, please. So this patient engagement tool, 5 moments for medication safety, this year for the World Patient Safety Day, the Directorate of Healthcare Quality and Safety developed short video clips in Sinhalese and Tamil, advising patients on when starting a medication to ask a healthcare professional what this medicine is, what are the side effects, and on taking a medicine to ask about how it should be taken and what to be done if they develop a side effect, and then on adding a medicine, whether that medicine is really needed, and then whether it would interact with other medicines that the patient is taking, and on the need for the medicines to be reviewed by healthcare professionals, and when stopping a medicine, how to do that, and if they have to stop it due to an adverse effect, how they should be doing it. So these short video clips in native languages were circulated through social media. And in addition, the World Patient Safety Day 2022 held a program for all the stakeholders, and also there was a contest between hospitals on medication safety activities that they have done, and best hospitals which implemented these activities were selected, and they were appreciated and given awards. Next slide, please. So in summary, the National Action Plan that we proposed was evidence-based, based on the problems identified in the country, and we identified the key performance indicators for each of these activities with a time frame given, and the implementation has been started. Next slide, please. So, implementing this National Action Plan that we have developed and started implementing will help to achieve medication safety in Sri Lanka. Thank you very much.
Thank you very much, Priya. And it just remains for me to thank both our presenters. I hope you've seen from today's two presentations from Mongolia, from Oyun, and for Sri Lanka from Priya, the richness of the work that they've been doing in order to address medication without harm. And we thank you for joining us.